If you're turning 65 and confused about Medicare, you found the right place. In the next 15 minutes, I'm going to show you exactly how Medicare works and how to think through supplement versus advantage decision and how to avoid the costly mistakes that I've seen retirees make that cost them $20,000 or more. Now, the best part is you don't need to register for any webinars. You don't have to drive across town and sit through a boring Medicare dinner, or you don't have to read through stacks of textbook to understand this. In the next 15 minutes from now, you will know everything that you need to know about Medicare to make a confident decision. So you can pause this video at any time to write things down because I'm going to be giving you specific numbers that you're going to want to remember. Now, my team and I have helped thousands of Medicare beneficiaries successfully navigate Medicare, but here's what most people don't realize is even if you choose the perfect Medicare plan, there's still massive gaps that can wipe out your retirement savings. Now, most Medicare educators won't tell you about these gaps because they don't know how to solve them themselves. But I'm going to show you exactly what they are and how to protect yourself completely. So grab something to write with because you're going to want to remember these numbers. And let's start with the foundation. So Original Medicare has two parts that everybody needs to understand. There's Part A, which is their hospital coverage. And every time you're admitted to a hospital, you're going to have a $1,736 deductible that you are going to have to pay out of pocket before your Medicare kicks in. This is a big exposure that not many people are aware about. Now, Part A is going to cover most inpatient services like hospitals and skilled nursing facilities and hospice care. So make sure to write that number down. That's going to be Part A, and that deductible is $1,736. Now, Part A usually does not have a monthly premium as long as you and your spouse worked at least 40 quarters, which is about 10 years, and paid into your Social Security taxes. Now, next, we have Medicare Part B, which is your doctor coverage. Most outpatient services are covered under Part B. Now, for this, you're going to pay a premium of $202.90 per month, which is the minimum amount in 2026. Everybody has to pay this, and you will also have a deductible of $283 annually. Now, the reason we say $202.90 is the minimum because there is a standard rate in 2026. High income earners may pay more for their Part B premium, and these income thresholds change year to year. So you'll need to determine which rate you will pay based on your situation. And here's the dangerous part with Part B. Even after that deductible, you're responsible for 20% coinsurance on everything with no cap. So let me repeat that. There's a 20% with no annual limit. So if you have a $100,000 medical event, you're going to pay $20,000 out of pocket. It doesn't matter if that bill is $1 million, you're still going to pay that 20%. And this is why nobody has just Original Medicare alone. Now that right there is Original Medicare. So from here, you have two ways to build on this foundation. So every Medicare decision comes down to one of the two paths. Path one is the Medicare supplement plan, often referred to as Medigap. So with this, you keep Original Medicare and you buy insurance to protect those gaps. The monthly cost is going to be around $120 to $200 a month, depending on your zip code. Plus, you will have to get a separate prescription drug plan. Now, the benefits is that you have the freedom to see any doctor anywhere in the country who accepts Medicare. There's no networks, there's no referrals, and that's almost all of the facilities that accept Medicare. Now, some popular plans on the Medicare supplement side are going to be the Plan G, which is the most comprehensive coverage, or the Plan N, which is slightly less coverage. Now, this is going to be best for people who want maximum protection and don't mind paying more monthly for that, so they don't run into any surprises in the future. It's a much more predictable way of knowing exactly what your out-of-pocket expenses are going to be. So that's path one. Now, path two is going to be the Medicare Advantage plan. It's also known as Part C. So with this, you will replace Original Medicare with a private health insurance plan that's required by law to offer the exact same benefits. So the monthly cost often on the Medicare Advantage plan is usually $0 a month, but you have to pay for that Part B premium still, which again is about $202.90 a month. Now, the benefits are going to be that these have lower monthly costs. It also includes prescription coverage as well as dental, vision, hearing, and gym memberships. And the trade-off with this is you usually have to have a network of doctors and hospitals, and you will have copays when you use your services. So here's the key. Both plans work great. It just depends on your priority, your budget, and your comfort level. The Medicare Supplement plan gives you predictability and freedom, and the Medicare Advantage plan gives you lower monthly costs with managed care. But here's what's critical and what most people miss. Both plans still leave you with major gaps that could destroy your financial security. But before we talk about these gaps, let me explain prescription drug coverage because this affects everyone. Now, if you choose option 1, which is the Medicare supplement, you must get a separate prescription drug plan and you cannot get prescriptions through Original Medicare. If you choose route 2, Medicare Advantage, the prescription coverage is built into your plan. Now, here's some critical Part D, the prescription drug plan rules that you will want to write down. Now, the first one is the enrollment penalty. If you don't get Part D when you first are eligible, you will pay a 1% penalty per month that lasts forever. So the next one is no more donut hole. You guys must have heard that or may have heard that term before, but it's not something that you have to worry about anymore. Now, the coverage gap is gone. After the deductible, you generally pay a copay for your drugs until you reach your annual spending cap. Now, for the next thing you'll want to write down as a critical Part D rule is the 2026 out-of-pocket cap. So for Part D plans, you will usually have a $2,100 annual max out of pocket. So once you spend this amount, you pay $0 for your covered drugs for the rest of the year. So this is where we come in. We run specific medication checks through Medicare's calculator to find a plan that covers your drugs at the lowest total cost. So most people save $500 to $1,500 per year with us because we do this properly versus just picking a random plan. So make sure to write this down. Never go without drug coverage and always tailor this to your specific medications. So let's now go into those gaps that we were talking about earlier. So the 3 critical gaps. I'm going to show you those 3 gaps that exist no matter which Medicare plan you choose, whether you go the Medicare supplement or the Medicare Advantage. Now, gap number 1 is going to be the critical illness exposure. If you're diagnosed with cancer, heart attack, or stroke, we call those the big 3. There's always non-medical approved expenses that go along with the diagnosis of these. So we're talking about experimental treatments that aren't covered by Medicare. There's travel costs that your Medicare plan will not cover. I know people that paid $1,000 just in parking fees at the hospital alone during their treatment. There's also specialized medication that can cost you thousands of dollars a month. And even if you're working and you lose that income for you and your spouse, that right there is another major gap that people don't think about. Now, the average cancer patient pays about $3,000 to $7,000 per year in non-Medicare approved expenses. So gap number 2 is going to be the skilled nursing gap. This is the big one that nobody talks about. So whether you have a supplement or an advantage plan, the most that Medicare will cover for a skilled nursing facility is 100 days. So after 100 days, you're completely on your own. And here's the reality is that 50 to 60% of people over 65 will need some form of extended care. So the average cost for that is anywhere from $8,000 to $12,000 per month. And the average stay is 2.4 years. So if we do the math, 2.5 years at $10,000 per month is $288,000 completely out of your pocket. And this can really hurt seniors financially, and it can wipe out everything that they worked for. Now, gap number 3 is going to be the out-of-pocket exposure. If you choose a Medicare Advantage plan, you can be faced with thousands of dollars in copays and coinsurance when you get sick. And the max out-of-pocket limits can be $8,000 plus per year, and that's just for Medicare covered expenses. The bottom line is that these gaps exist no matter what path you choose, but there's a solution that I'll show you exactly how we help bridge these gaps. But first, let me explain the critical time windows for Medicare enrollment, because missing these deadlines can also cost you thousands in penalties. So the first thing to take note and write down is your initial enrollment period. So you have 7 months total. That's going to be 3 months before your 65th birthday and 3 months after your birthday. And this is your golden window. And then you have 3 different scenarios that most people are going to fall in. Number one is that if you are on Social Security already, and if you are taking Social Security before your 65th birthday, you're going to be automatically enrolled into Medicare Part A and Part B, and your Medicare card should arrive 3 months before you turn 65. Now, scenario 2 is you're not getting Social Security yet. If this is the case for you, then you must manually enroll by going to ssa.gov or calling the Social Security phone number. And you can do that, again, 3 months before your 65th birth month. And number 3 is going to be that you're still working and on your employer coverage. In this scenario, you can delay Part B without a penalty as long as you have credible employer coverage. So if you are in the scenario, it's super important to compare your employer coverage to Medicare, because 60 to 70% of people we talk to that are still working end up saving money and get better coverage by transitioning onto Medicare, even while they're continuing to work. So here are some critical timing notes. Medicare starts the first day of your birth month, or it starts the month before if your birthday is on the first of the month. So if your birthday is on March 15th, then it will start March 1st. But if your birthday is on March 1st, it will start on February 1st. Now, if you're going to go the Medicare supplement route, the best time in your eligibility window for that is going to be 6 months before your 65th birthday. And that's going to allow you the best rate and guaranteed acceptance, and just get it checked off and over with. If you miss this window, you could pay several penalties for life or be denied coverage. So these windows are very critical. So make sure that you write these down. But again, our team can help you with all of this stuff. So here's how it works. We're able to close almost every gap by strategically building out the perfect protection package for your situation. Regardless of the route you choose, there is a package designed specifically for you. And if you choose the supplement plan, if you choose the supplement path, we would add a prescription plan. We would add critical illness coverage to protect you from the big 3, which is cancer, heart attack, and stroke. And then we would add a skilled nursing protection to cover you after Medicare stops paying after 100 days. And finally, we would add dental, vision, and hearing coverage if that's something that's important to you. Now, the Medicare Advantage path, we would add that same critical illness coverage to protect you from cancer, heart attack, and stroke costs, and the same skilled nursing coverage to protect you past those 100 days. And then we would add an out-of-pocket protection coverage to protect you from the hospital copays, the ER visits, outpatient surgeries, and things like ambulance rides as well. Now, both packages eliminate almost every financial risk that you can face. So you just pick your preferred healthcare coverage style, and we build the right package around that. Now, look, most Medicare advisors only help with Medicare plans. They don't help with the gaps that exist, which is why 80% of Medicare recipients are sitting ducks financially. Now, my team's strategy is different. We don't just get you enrolled in Medicare, and we make sure that you're completely protected. Our clients tell us all the time, I thought I just needed Medicare help, but this complete protection is what actually saved my retirement. So let me now address some myths about people working with Medicare professionals. Myth number 1 is I have to pay a fee to use an agent, and this is completely false. We charge absolutely no fees of any kind, and there's no extra costs involved at all. Myth number 2 is that if I use an agent, insurance companies would charge me more. That's also false, because you pay the exact same price whether you work with us or go directly with the carrier. Now, the crazy part is if you go do this all on your own, it could take forever, give you a headache, and you'd still end up paying the exact same price. And then myth number 3 is that agents are biased towards certain companies. Now, here's the truth is that we represent over 40 different insurance carriers all across the United States, and they all pay us virtually the same. So we work for you and not the insurance company. Our goal is just to keep you happy and protected. And now here's what's urgent is Medicare has strict enrollment deadlines. And if you miss those windows, you could pay penalties and be denied coverage. So we do not let that happen. All right. So now that you understand Medicare better than most people who've been on it for years, but understanding and having a plan are two different things. Here's what you need to do next. You need a personalized Medicare protection plan based on your specific zip code because plans vary dramatically by area. You're going to need to check your doctors and medications, your budget, and protection needs, and which protection plan fits your specific situation. So here's exactly what happens when you schedule an appointment. We're going to analyze your specific situation and medications, show you exactly what the costs are for both Medicare plans in your area, configure your complete protection packages, and handle the entire enrollment process for you. The appointment is completely free and there's no pressure, there's no fees, there's just real answers. Now, our goal with each of these calls is just to be a resource for you and give a formal recommendation based on your specific situation so you don't leave your retirement vulnerable to Medicare gaps. So click the button below to schedule your appointment and let's get your Medicare protection built properly. After your 30-minute appointment, you'll have a complete confidence in your Medicare situation and total protection. So click the button now to schedule your call. We'll talk soon.